Well, in this week's Cardiology Countdown, we have an interesting mix of things about chocolate, computers, and losing weight. So at the number 3 spot is a terrific review published in the European Heart Journal, where we have a 10 points to remember journal scan on this, looking at flavanols. And these are the biologic substances within chocolate that we believe are helpful in vascular health. There have been a series of studies, and we've reported them on Cardiosource and Peter Block with the Heart Minute, about the benefits of chocolate in small quantities, and the darker the better, in seeing improvements in vascular biology, and notably the vasodilation that's dependent on the endothelium. But there's a lot of further basic science biology behind that, and that is reviewed in this terrific article. They do point out, though, that there aren't large outcome studies of eating small bits of chocolate, but this looks like a promising area of research. Well, at the number 2 spot is a surprise finding from a randomized trial of computer order entry and a look at the alerts for drug-drug interactions. This is something that we're all getting much more used to seeing because we have computerized order entry and electronic medical records. And there's been an increase in the focus on safety alerts. So these investigators in Philadelphia randomized centers to receiving special alerts about the interaction between warfarin and Bactrim, trimethoprim sulfa, antibiotic, and just the usual care of general alerts. And they found that having a pop-up alert warning of that interaction prevented ordering of the antibiotic and hence avoided a medication interaction. But they actually stopped the trial early because there was a delay in giving any antibiotic in 4 of the patients where it was felt that could have harmed patient care. And so an important reminder that sometimes these alerts can have unintended consequences, and we have to be mindful that we don't throw up alerts in every which direction that could actually harm care rather than make it safer. Now, at the number 1 spot, I've picked the 4-year results from the Look Ahead trial. This, as you may know and we've reported previously, is a large randomized study looking at intensive lifestyle intervention as a weight loss approach to see whether that could impact on cardiovascular outcomes. We've obviously seen a lot at the FDA rulings on other obesity drugs where safety side effects have been an issue, and this is using lifestyle intervention. So at 4 years, they report a continued benefit on weight loss and of many risk factors with the intensive lifestyle intervention. That's a really multimodality approach. The weight loss does fade from what was seen at the 1-year results as previously reported, and that's something that we unfortunately have seen a lot. But there are persistent benefits in the intensive lifestyle management approach. And so we'll be watching over the coming years to see whether that can impact positively on hard cardiovascular outcomes. So with this week's Cardiology Countdown, I'm Chris Cannon.